Welcome to a full week in my life doing general surgery rotation. We're currently doing major ward rounds, starting from the intensive care unit and now going to the wards. And that's just what?
Each person picks something. Someone can do general examination, and then somebody else can do respiratory, and then we teach each other.
Together, yes. So major ward round is when you go around checking up on all your patients, making sure they are up to date according to their treatment plans. And in general surgery specifically, this involves a lot of wound cleaning. And those could be surgical or ulcers or burns.
And there is a patient that was transferred to us yesterday from Redfield. Okay, get the bed. Let's get on the next 2 months we'll be having a wedding.
How do you do it? Come on, say Gamma. Never be agitated. But the drama car okay.
What is expected of us as medical students during major ward round is presenting the patient that you clicked. Clicking is when you go up to a patient and ask them questions that are supposed to help you come up with a diagnosis. So that, together with physical examination of the patient, helps you come up with a diagnosis and differentials. We also have tutorials after and during the rounds.
If you exhaust all the patients here, I even said yesterday, do not restrict yourself to my ward, to my patients. You've got patients in other surgical wards, go and start those patients as well.
Hello.
It's not a big shot.
Yes, I know.
So that was my friend Faith, and we are on our way for clinic. And this is a time when patients come to see the doctor either for a review or you'll be seeing them for the first time. This is usually for patients that are coming from home, so it could be people that have already been discharged or people that were never admitted. So a patient will come in and sit while my friend is seated, and the doctor will be on the other side, and they'll have a chat about their health, whatever has brought them to the hospital. If it's a review, you want to learn about their progress, how they're feeling so far since whatever brought them to the hospital the first time. If it was surgery, you want to find out how they're progressing. We were quite early, so this is when everybody else is coming in. The doctors are not even here yet. While the doctor is talking to the patient, she can begin to ask us questions like, what do you see in this patient? What additional questions would you like to ask for you to reach your diagnosis? What do you think the diagnosis is? What tests would you ask for to confirm your diagnosis? Can somebody read this x-ray, please? You know, things like that. And these are the mini meetings we make if we don't know the answer and we're trying to discuss while the doctor is carried away talking to the patient at the time. We also had a list of topics we're expected to study before coming, so that when you come, the doctor just teaches in between the patients whenever she's free. So this here is a teaching moment as we wait for the next patient to come in. So they ask us questions, and depending on our answers, they either correct us or they just say what she said and then add on to that. Not all students in the unit are from the same university, by the way. So we have students from Apex, Unilas, some from China, others from Levy. I'm yet to rotate with anyone that is from Texila University, but those are also at this particular hospital. So this particular patient had a leg ulcer. As I said, there's a lot of wound cleaning, dressing, and surgery, and clinic day is no exception.
So you said, what's happening with the discussion? Me, I heard someone say, we're going to have a discussion after we're done.
No, we're supposed to.
No, sorry, everyone else gone. I mean, the others have left. So.
We are the others also.
Today is a Friday. We have got an appointment.
My sister.
Oh gosh. Okay guys, no more 13 hours and we're done for the day. I am about to go home now. Bye. How did you feel about surgery?
Surgery was okay. I feel like for the most part, I enjoyed code days more because I never slept here though. We'd be here till like 22, 23 sometimes. I didn't come for post-core.
How come you were allowed not to?
Yeah, because we start our core days, let's say 8 hours sharp. We'll be here the whole day till 23. So the interns will actually let us off and say, since you guys have been here the whole day, you don't have to come in for post-core.
Guys, this is the thing with most of our units that's so different. Some people would get away with other things that other people would never get away with. Like, I would never miss post-core. That's just another thing.
Enjoyed surgery.
Surgery the most. What unit were you in?
Yellow.
You're in yellow film? How was yellow film?
Yellow film was wild. I want to be lying. Yellow film had there was so much going on in yellow film. It was just, but it was nice. But it was interesting. But it was interesting.
Did you spend your core days here? Or did you have to go?
But the whole night.
What time did you go?
Sometimes 18.
18.
On other days 22.
What time did you have to be here for postcon?
Guys, 6. Before 6 actually, and it was a thing. You have to be here before 6. If you're not here before 6, that's problems. I don't drive, guys. I walk.
I was actually in the same firm with the other two girls just a month before them, and this is me walking to the hospital at 5 something just to make it in time for post call. If you come at exactly 6 hours or 5:59, you're already late.
So you're in the same firm with her, right?
With her. I was in white film, then I moved to blue. But I really enjoyed yellow film. I've never spent a night, but I'm yet to try. This year.
Ma'am, have you ever spent a day in the hospital since you started?
But the ladies have left this place now in 22.
On the other day, I decided to eat some shima and bondwe and beans because I was thinking I'm not going to doze, I'm going to stand anyway. Turns out you can actually doze while standing, and I'm not speaking from experience, right? It wasn't me. The other day is when you do the surgeries scheduled for that day. It's usually about 2 to 3 surgeries, sometimes 1, especially if it's a long procedure. You can wear whatever you want coming in, but you have to pack clean scrubs and clean Crocs to change once you get there. And we're finally in the changing room. Then I had a brief meeting with myself, just talking to myself, saying you're going to answer questions correctly in there. You're not going to embarrass your family or your ancestors, okay? We've got this. So I changed into my scrubs and then wear my Crocs as well. As students, we do not have lockers, so we put all our things in our bags right on top. Now, who's ready for some endless questions and constantly being told you're not studying enough every 2 seconds? Because that's where we're headed. So I get there and they're still trying to set up everything in the operating room, so we have to wait. So we just hung out in this tea/lunch break room.
But I'm doing very well, you will not show you for me.
Oh, God, you didn't come. Oh, so you people, you can't like say you have nothing to do, but when you come here, you can't answer questions.
So you guys have done this.
So we chat a little bit and then continue studying and discussing, because the topic discussion continues even in theater. They still teach us from there as well, while also asking us a lot of questions. So you have to make sure you're well prepared, because after 2 or 3 failed questions, you just hear, which school is this? Good surgery.
Those that was get it.
No, I mean, the video treatment.
The hepatic plates are arranged in such a way. Those hepatic cells, they are arranged in a column. They are 2 columns.
So the procedure finally begins after waiting for a little while. Once it's done and you have more than one procedure, you either wait for them to set up again or you go into the next operating room.
When they're talking about media recognition injury, the one that causes GGT and 5NT, those markers, the markers for hepatitis injury are going to be the ones now, AST, ALT, those are the ones. But those are markers for what?
So while we're waiting for the next case, we discuss about the next procedure, because we expected to have started about the procedure before going in. The procedures that were done often in surgery were skin grafts, because there were a lot of burn patients. A skin graft is where they remove a part of your skin and put it on another part while you're bent. Say if you're bent on your hand, they will remove some skin from your thigh and put it on your hand. And yes, it will grow back on your thigh. It's almost time and everybody's trying to go through their Hutchinsons or SRBs on their phone. What book did you use during surgery? I would like to know. Please comment down below. The procedure is finally done and we can now go home. The commonest procedure in my unit was a Whipple's procedure, and that took on average about 12 hours in total. But we didn't have to stay for the whole 12 hours. They would release us around 13-14 hours, so halfway into it. One of the indications or reason you would want to do a Whipple's procedure is if a patient has pancreatic cancer. That's just one of them. So if the cancerous part is on the head of the pancreas, they'll cut off that part and then connect it directly to a part, the nearest part of the small intestines, which is usually like the jejunum. It's way more complicated than that, I'm sure, but in a nutshell, that's it. In this life, no matter how hard surgery gets, you need to stop and smell the roses or whatever flowers these are, and also eat some mulberries, okay? Just have a good time regardless. So we dealt with a lot of patients with similar pathologies most of the time. And I think that's dependent on the specialty of the consultants in your units or firms. So we had a lot of patients with jaundice, so you needed to know the biliary tree, things like intestinal obstructions very well. Plus other conditions that were generally common like wounds, leg ulcers, burns. My favorite thing about general surgery had nothing to do with general surgery itself. It was about how hard the doctors pushed us to study. Yes, we were stressed, but we survived.